What are some of the things that you should be considering if you're on a PPI? Now, PPIs, or proton pump inhibitors, are used to treat conditions like GERD because they help inhibit stomach acid production. These can be effective treatments, but they do come with some considerations if you're on them. The first one is consider how long you're going to be using it and what dose you're going to be staying at. Ideally, PPIs are not going to be used long term. Every case is unique, so this is important to discuss with your doctor so that you know what the duration is going to look like for you and how you're going to monitor this over time. Likely, you may need a holistic approach from a full healthcare team, including a dietitian, to get to a point to reduce it. When you reduce your PPI, make sure you taper down slowly. There is a such thing as rebound stomach acid production, and you may notice that you have worsened symptoms after you stop the PPI versus when you began it. This can be expected, and so tapering down as slow as possible will help you prevent this a little bit, and knowing what to expect and how to address those symptoms when they hit so that you don't just have to restart the PPI right away can be helpful. Monitor your nutrient levels. Some nutrient deficiencies are going to be more common with PPI use, including B12 deficiency because stomach acid is needed for B12 absorption, but you'll also want to monitor your calcium, magnesium, and your iron status. Making sure that your diet is rich in these foods, maybe even utilizing some supplementation may help. This is something that can be addressed with your personal dietitian. And because calcium absorption may be limited and bone loss may occur in some patients with long-term PPI use, it's important to also be addressing your bone density with weight-bearing exercise as well as your calcium intake. In some cases, PPI use can also impact your kidney function, your liver function. It may even increase risk of infection. This is not one size fits all for every single person. So make sure you are discussing it with your healthcare team so that you know that the treatment that you're utilizing is the best for you, your body, and your needs.